diagnosed with breast cancer in October 2010. When I originally found the lump, I was turning 35. My doctor had told me, my GYN doctor had told me that when I turned 35, I would be eligible for mammograms. So when I found the lump, I knew I had an upcoming appointment, and I figured I would follow through at that time and have the mammogram. When I met with my doctor, he had told me that that had changed and that the age was now 40, but due to me finding it and some family history, he would recommend or follow up and send me for a mammogram. He referred me to a general surgeon. I met with the general surgeon, had a needle biopsy and then a core biopsy, but was not diagnosed with breast cancer. He advised that I should probably have the mass removed. At the time, he thought it was a fat necrosis. And at that point, I decided to seek a second opinion. I made an appointment with Dr. Schultz. So Dr. Schultz met with me and my husband and my family. We talked about everything, and from that point, I tried to do fertility, but fertility didn't work out. I had my surgery in December, and I started chemotherapy in January. I finished radiation today. Today's my last day. I did 30 rounds of radiation. When I was first diagnosed, I met with Dr. Schultz. He had mentioned the ALTO study to me and said that I would be eligible. When I left his office, of course, I had a lot to deal with and a lot going through my head. I did a little research of the ALTO study myself, and then when I met with Dr. Gafar, he had mentioned it to me. I told him what I had known about it. I felt it was the best thing for me to do. I don't feel like I'm a test subject. I feel like this could help me, and this could eventually help someone else. And that's the main thing here. We need to find a cure. I feel as a clinical trial participant that I'm receiving really good patient care. I have my own nurse who I stay in contact with pretty regular. I feel even when I was in the infusion area, I had a special nurse there. I just feel overall that Dr. Gafar is wonderful, and he's doing everything he can to help me. And by me having the research study behind me and the research nurse, I feel like I have a lot of support here. Coming to St. Joe's was a really good move for me. The one thing is, I'm a planner, and I worked my whole life to do certain things. And I had just gotten my master's degree right before I was diagnosed. And of course, my family was the next step. And cancer popped up. But I've been fighting, I've been strong, and I'll get there when I get there.